We're honored to have Dr. Altha Stewart, the upcoming President-Elect, joining us at the table this morning. Thank you so much for sitting down with us.
Thank you for inviting me.
How's it all going so far?
So far, so good.
Great.
Congratulations.
Thank you. Thank you very much.
So what does this year hold for you?
Lots and lots of new activities. I'm currently secretary of the board, so I've been involved in the APA Board of Trustees now for the last couple of years as the secretary. Moving up to President-Elect, though, means that the number of activities and the amount of responsibilities is going to increase significantly. Lots more meetings, lots more association gatherings, more responsibilities. For example, I now will, as President-Elect, chair the Joint Reference Committee for the APA. I'll be a participant at assembly meetings and do a variety of other things.
It's an important milestone to point out that you're going to be the first African-American APA president. What does that mean to you, and why is diversity so important in your own words?
Well, for me personally, it means that some of the work that's been done over the last, 50 years or so, to better integrate, if you will, into the working of the APA, a larger and more diverse perspective and voice is finally coming to fruition. I'm certainly humbled and honored to have been the one who actually ran and was elected, but I recognize that I'm standing on the shoulders of some people who did a lot of work to make this happen. And so I'm hopeful that I will do them proud. And I think that for the organization, it means that there's now a visible symbol of what we've been trying to do for the last, like I said, 50 years. That there is room in this organization for a lot of diverse perspectives, and each president brings their own perspective and puts their own stamp on their presidential year and on the initiatives. So clearly I'm going to have a focus on some things that reflect my professional interests, my personal life experience, and my belief as to where the APA can go from here.
Well, let's pick up just a little bit on that, some of your own personal work. I believe that you center on youth at risk. Tell us a little bit about what you're working on.
Well, I'm the director of the Center for Health in Justice-Involved Youth at the University of Tennessee Health Science Center in Memphis, Tennessee. And that role evolved out of a desire between the medical school, the juvenile court, and the county mayor to create an environment where we focused on children who were on a path into the justice system from a public health approach instead of a law enforcement approach. So I'm able to bring issues of trauma and the impact of trauma on children and their behavior that might wind them up in that system. I'm able to work on those things from the service standpoint, from the research standpoint, and from a community engagement and training standpoint. Many of our cities experience lots of community violence. Children live in those cities and are impacted by that. And so the work that we hope to do at our center will be reflective of what the current science is and what kinds of best practices exist, and also be something that's replicable so that it can spread around the country.
Well, thank you ever so much indeed for joining us. We really appreciate it.
Thank you for inviting me.